So with that, I am so delighted to turn this over to our crew for today, this fantastic team who represent both internal and external researchers within the university and then beyond. And so we have here in person with us Maria Blancas and Denise Drury, both with the Pacific Northwest Agricultural Safety and Health Center, PNASH, and also with the Department of Environmental and Occupational Health Sciences. And then joining us by Zoom, we have Elizabeth Torres. Hello, Elizabeth. Thank you so much for being here. And you're muted, but I assume you can unmute yourself when the time is right.
Yes, Kai, thank you for inviting us.
Thank you so much for being here. Could you hear Elizabeth in the back? Not so much. So we might need to do like this little fancy thing like that. Okay. And Elizabeth, I didn't capture everything, but is representing El Proyecto Bienestar and also Radio KDNA. And I think I might have left off the second half of the radio's name, but in any case, we have these researchers coming to speak about farm worker health education related to heat and smoke protection. So very practical, applied research to practice, opportunity to hear this important work, especially in our state, but also much beyond that as well. So thank you for being here, and I'm going to bring up your slides and turn it over to you. Let's warmly welcome our guests.
Everyone. All right. Just want to make sure this works. Maybe not. Okay. Hi, everyone. Thank you for the invitation. We're excited to be here. Excited to see the overview of the seminar speakers that you've all had. It sounds so great. Kind of jealous. Kind of want to come back and be a student or sit in some of these presentations. But today we're here. I'll let Denise and Elizabeth introduce themselves, but we'll be talking about climate impact communication and farm worker health, a topic that's really dear and close to all of us. And we're excited to, let you all kind of see a little bit of the work process that we use. There it is. Sorry, got it. All right, so I'm Maria.
Oh, I'm Denise.
And you saw Elizabeth on Zoom.
Elizabeth Torres.
Okay. Okay, so today we'll talk a little bit about health disparities, farm worker health disparities, and the exposure to heat and wildfire smoke. We'll also learn about how partnerships with community-based organizations can help communicate health and safety with farm workers and agricultural communities. And then we'll also learn a little bit about how community academic partnerships, the process that we use, and how effective it's been in our efforts and work.
I'm not sure we can see Elizabeth.
I wonder if...
Just trying to get Elizabeth, who's on Zoom, to be able to be visible.
Can I pull it over? There we go. It's because it does like the duo screen. Yeah. And then I'm going to make you a little bit bigger, Elizabeth. All right. Okay. And then we'll come back. Where's the mouse? Okay. There you go.
So first we wanted to begin talking to you about our center. So we're part of the Pacific Northwest Agriculture Safety and Health Center, and it's a center focused on occupational health, so understanding causes of injuries and illnesses, and working together with community stakeholders and workers to develop solutions, whether it be training to policy recommendations. And we have a partnership with El Proyecto Bienestar, which Elizabeth leads, so it brings in different partners from the community to talk about issues that really affecting their community. So they help shape a like what topics we focus on, what we prioritize, and how we approach it. And Elizabeth will be talking more later about the perspective that they bring to this work.
All right, so as we get started, as we're going through this, we're gonna watch a quick little video, which should already be here. Just gonna make it a little smaller. And make this one. No, you're fine. There it is. All right, so we're gonna go ahead and start with the video. I like to always, some of the work that we're doing is focused on farm workers and their stories are often not heard, right, or seen, and so we try to bring them in as much as we can into our spaces. So here's one video that you'll hear from them.
Nuestro trabajo, el trabajo que nosotros hacemos es la vida. Porque nosotros plantamos una planta que dé fruta para que coma la gente, para tener fuerza, para tener salud, para tener energía, para poder sobrevivir. Nosotros, nuestras manos, plantamos y limpiamos y cosechamos la fruta. Entonces el trabajo que nosotros estamos haciendo es la vida de todo el país.
Yo soy de Oaxaca y hablo mixteco y la gente indígena que vienen aquí a trabajar, somos gente, hay gente que habla triqui, mixteco, zapoteco, yo hablo mixteco. Pues la vida es bien pobreza, en mi pueblo bien pobreza en Oaxaca y pues venimos aquí por necesidad.
Es trabajo que hay ahorita, la poda y la poda almendra, de pistacho, de todo, de durazno, netarín, lo que hay ahorita son podas. O porque trabajo temporada cada año, pues cuando acaba trabajo aquí, no exactamente que no acaba, sino que cuando viene el tiempo de calor y pues casi nos acostumbramos mucho al calor, por eso vamos para Washington. Una temporada ya cuando baja el calor y regresamos otra vez, pues ahí tenemos trabajo todo y pues el gasto también es alto ir para allá y pues luego llegando allá pues mal vivienda y pues mal pago y no es justo.
Toda nuestra gente indígena, todo pues los que no hablan español y todo pues tiene miedo porque no hay facilidad de defenderse.
Como anda uno con miedo, no puede uno salir así a la tienda o a la calle porque tiene uno miedo de que nos encuentre y nos deporte allá.
Tenemos que trabajar de rodillas y lloviendo y cansado de la espalda o de la cintura o de los hombros, así, para ganar dinero.
La verdad es un trabajo muy matado. Está comprobado científicamente que un trabajador de campo no pasamos de 50 años. Si empiezas de los 15 años en el campo, no pasas de 50. ¿Por qué? Porque es un trabajo muy pesado. Pónganse a pensar poquito, esta gente trabaja para su familia, pero también trabaja para que todos comamos. Yo pienso que ya es tiempo de hacer algo por la gente del campo. Es la única gente que somos discriminados día con día. Tenemos que aguantar discriminación, maltratos en la comunidad y en el trabajo. Yo pienso que es tiempo de respetar a la gente. Siempre hay un tiempo donde hay una oportunidad, donde puedes hacer algo por alguien y hay que tratar de hacerlo.
Por eso yo quiero, si es posible, que haya unas leyes que protejan los campesinos. No es por mí, aún va a ser por mi niño que está allí. Tengo 3. Eso va a ser para los futuros.
So we're going to go ahead and do a little activity. We're going to adapt it just for time, but these slides will be shared with you all. But here's a case study that's pulled from our HEAT toolkit, which we'll hear about a little bit later. The activity, ignore the question. We're going to adapt the question to being, what factors did you hear in the stories, stories from the workers in the video? Consider their work environment, what we heard from their work environment, their living conditions. Did they mention anything around healthcare access or socioeconomical factors? I'll ask you to talk and discuss those with people that are sitting next to you. The socioecological model is there. Have you all learned about the socioecological model? Yeah? A little bit? Really quickly. The socioecological model looks at how all of these different layers and factors impact one's health, right? And you can see from the individual to interpersonal, which is more like family, social community, community workplaces, neighborhoods, to the outer layer, which is more policy and society. We'll give you all 2 minutes, and then we'll ask for 1 or 2 volunteers to share back what they discussed with their group. Is that okay? All right. Okay. So again, the stories that we heard from the video, what factors did he hear that might be across these different layers that might impact their health? I'll bring her over. All right, we're going to bring you all back. It sounded like you were all having good conversations. 1 or 2 of you or more that may want to share back on what they heard and what they talked about. Yeah.
We talked about a variety of factors that are both
A variety of factors that are both physical and mental that all factor into one's well-being. Sitting in fear, just walking to the grocery store that you could be deported is a very real concern. And each day you're not sure if you have a stable home, and you're pouring so much into this work to supply the food for the nation, and yet you can't even afford to feed your own children. This is something I've seen up close. I'm from Northern California, and so I've passed those fields and seen the migrant workers. One of my dad's workers grew up working in those fields with her mother, immigrated from Mexico, and just the devastation of, we don't always look at those people as human. We look at them as arms and legs, and it's can all impact their mental, physical, and just living situation.
Yeah, thank you for sharing that. Yeah, definitely often invisible, right, to the food system. Yeah, go. I'm gonna try to run up there and see if this mic will help. I'm gonna get in my steps today, for sure.
I think one thing we talked about was that it might not even just be like the specific like mistreating of people, but also their own internalization of that mistreating. If they're not feeling healthy, if they're not feeling like okay physically, they might be more hesitant to like go to a doctor's office because they feel like they're not going to be treated well. Something one of the people in my group brought up was that there's language barriers, and it's also not always languages that are easily translated, because we might not have translators for languages, like some of the indigenous languages that were mentioned. I don't know if we readily have translators available for those. So even if they overcome that mental barrier of like, okay, I'm going to go get myself healthcare, and even if they find ways to get access to healthcare, the service might be like really difficult for them because they just don't have those resources that are tailored to their needs.
Yeah, thank you. Yeah, definitely very important to talk about. Sometimes farm workers get grouped together, right, as one community, but there's a lot of diversity amongst workers and the languages that are spoken. Anyone else have one that they're like wanting to share, or were those all kind of summarized? One more. Okay.
I think apart from what everyone said, there's also a fact that their families may not be together with them, which is kind of forcing them to work despite all the condition. And second, they don't have any laws protecting them. So laws are probably against them. So they're scared to get any kind of, not even medical care, even the general care is not accessible to them. So if they're just scared that they're unregistered and they will be deported back. And all this together in an individual level, it'll affect them mentally, physically, causing them probably to die faster, which they showed in the video.
Yeah, thank you for that. Lots of really important pieces. We're going to touch on the protections that are in place for workers. But as you all kind of mentioned, right, there's all of these different factors that impact their health, right, and looking at the health disparities that they may experience. You can see here, right, we'll talk about extreme heat and wildfire smoke exposure today and some of the materials that we've created to address that. But they're also exposed to pesticides, as some of you all mentioned, lack of access to food or quality food, right? Although they're harvesting the foods, a lot of them don't have access to healthy foods. Earlier in the poll everywhere, they talked about water, right? That's also an issue in a lot of Washington State and the Lower Yakima Valley, right? Having access to clean, safe drinking water. And then we heard a little bit about housing characteristics and, of course, as you all mentioned, right, access to healthcare services. So I'm going to hand it over to Denise. I don't know what you want to use. This one or that one?
I wanted to mention everything that y'all are saying, like all these things that you all are talking about, we can connect them to like broader factors in society. Like what, like for example, this person shared that talking about people of different languages. Well, if you look at the social ecological model, you can think about communities and access and networks of support that are inclusive to them, like that are missing. And also what was mentioned was thinking about like hazardous conditions in the workplace. Well, if we look at the policy level, there's a lot missing. And also workers specifically mentioned that themselves in the video, as Maria pointed out, that they want protections. And agriculture is actually excluded from a lot of regulations that other workers have. So that's another factor that makes it hard for them. And then we also wanted to give the broader view of our work. Maria, I don't know if you wanted to share, but just some of the impacts that our work in collaboration with communities has brought out. So we collaborate with a lot of stakeholders to bring awareness to all these issues. Workers already know what are affecting them, and they help us see that, but we work together with different partners in the community, and Elizabeth will share later on the radio, just to make sure that everybody knows these needs and these realities and these gaps that exist for these communities. We also work together to develop resources, with workers and also with people in the community, like Elizabeth Torres, that are from this community, are trusted by this community, and know what they need and what will resonate. And then also, like I said, campaigns that span regionally, and we'll talk about one that we also did nationally. And then also work training specifically for the workplace that helps them understand the rights that they have, like the things that their employers are supposed to be providing and the measures they're supposed to be taking to keep them safe, to raise awareness for that for workers. And then also, I think one of the biggest accomplishments of this work is that the research findings that the research project that Maria was a part of and led by June Spector and Maria Blancas was also trying to look at risk factors, like what are these conditions in the workplace that create risks and health disparities for workers, and they use that to inform policy for workplace rules in Washington and Oregon that look at exposure for heat and wildfire smoke, and also provide national guidance for other states that don't have these protections for workers. So Washington, Oregon, California, there's a few ones that do have these protections, additional workplace protections for workers to think about how much they're exposed and how they can be protected. There's a lot of states that don't have that, and I feel excited to work with this team because they're helping inform that national conversation about what's needed. So we were also talking about all these different factors from a system level that impact health. Work is a huge one. Like your workplace, how many of you have ever taken a class on occupational health or have thought about work as a determinant of health? Raise your hand. Okay, good, that's good. So we spend a lot of time at work, 8 or more hours. During harvest, workers work 12 or even more hours at work. And so, and if you think about outdoor work and the conditions that workers are exposed to, like heat, wildfire, which actually in our state, those factors collide. Like when there's the highest temperatures, when there's a largest amount of smoke is during harvest. So something that we focus on in this work that we'll share is raising awareness of these things that employers are supposed to be doing in our region to protect workers. And so these also follow like a system level thinking. Like what sort of safety plans and programs do you have? How are you making workers aware of their rights or procedures? Even engineering solutions that they're taking to, ventilation or shade or masks or just other things, or what are they going to do in case of emergency to protect workers? Oh, there's some, if you guys want to know what's in the rule, but I think the reason that we put that in there is because if you look at the rules, like if you look at the rules of how to protect workers for heat and wildfire smoke, it's so dense and hard to understand that even that even the people that write the rules and even experts in the field debate on what they mean. So imagine the everyday person, how they would understand it, and that's why we work with a bunch of community partners who really help us make sure that this information is accessible and relevant for these communities.
Yeah, and just as a note, the video that you all saw, right, they were asking for different types of protections. That was pre these rules being in place, and that was actually a video that was used to try to promote and advocate for heat rules in Washington State. So we're gonna move over to Elizabeth. She'll join us really quickly about how we partner with communities.
So thank you for inviting us to do this presentation. My name is Elizabeth Torres, and I am the Director of Operations for Northwest Communities Education Center, Radio KDNA. But I'm also the Research Coordinator for Proyecto Bienestar. So one of the things that it's, when we talk about research and we talk about how do we bring the information back to the community is really important. And that's where, as stakeholders, community partners, we come together and we have been able to develop what we call a co-development process. So really, the aim is to produce and understand materials that are easy to understand, that are English and Spanish, that really bring the information back to the community. This process, we're talking about collaboration. So Denise touched a couple times in collaboration. So it is really important when we do these projects to establish good collaborations that will help us to develop in a process of co-developing materials. So what we do is we really want to, with this process, we really want to bring back the results of any research to the participants, to the partners, to the community, and really bring what are those opportunities for the community or organizations to that can adapt our materials or use our materials to promote the safe and health in our communities. And so what we normally do is we set up, our collaborations. We're looking at identifying first what are the needs of the community, what are the things that our community needs. So that's the first thing that we always do, looking at how our community really, instead of coming from the research base of I'm going to do this research, is I'm going to focus on what the community needs. And so then we start, once we develop, draft up the messages, and we normally do it in English and Spanish. We get the feedback from the community, and especially, is this understandable? Is this easy to promote? It's our community gonna understand it. Then we'll start developing the materials, right? The resources, whether if it's an infographic, or it's a print material, it's a radio announcement, it's a social media infographic, or it's a video, or it's a technical tool. So we start developing the materials. Then we go back to a technical review, really making sure these materials are providing not only good information for the community, but they are going to be, what we call practical solutions for our community. And then we're going to the process of disseminating this information. So looking at how we're going to disseminate this information. Are we going to do it through social media? Are we going to do it through radio? Are we going to do it in person at a health fair? So it's really looking at how we're going to be delivering these materials to the community. So over the years, we, with this collaboration, we have produced over 25 different products using this co-development process and distributing this within our community. And our audiences always have been workers and employers. And so we have developed, a lot of different materials for COVID, for the heat-related illnesses project, the wildfire smoke. And normally the process that we follow, that we do, it's really how do we translate these documents. You know, many times you get a technical document from a state or a policy or a recommendation that comes out. Like, for example, when COVID started, the Department of L&I was coming up with all these different recommendations on how to keep the employees, the workers safe. But they come up with this technical document that when you are in the community, it's hard for our community to really grab these requirements or recommendations and put them into place. So what we did is I really take this document and develop messages, both English and Spanish, making sure, you know, is this the messages that we want to capture so the community is safe. And so together we work to create these short messages, accessible English and Spanish, and that they really are going to keep our community safe. And then place it into a document, you know, do a final product. We developed this infographic. So it was one-page, you know, infographic with all the different recommendations. So it's like, how do we develop these materials? It's the process of, you know, taking this document and turn it into a product that is going to be easy to read and easy to understand, and in the language that is preferred for our community. Like, for example, when we also, and we can work on a lot of different materials, right? We have done radio, we have done social media, but we also been able to create a whole training toolkit. Like, for example, the heat-related illness training toolkit that we developed. So we were able to develop all these different materials that were, for example, we developed this big, you know, poster that the employers could use that has all the different symptoms about heat-related illnesses in both English and Spanish that we were able to use it either as an individual tool or tied it up with the training curriculum that was developed. And so these are some of the materials that we are able to produce as we work with our community. So it is important for us to really, when we use this co-development process, making our community and especially the workers part of the process. So, and with that, I'm going to turn it back to Denise and Maria.
Yeah, thank you, Elizabeth. Yeah, I was trying to like scroll through them as fast as I could, so you all can take a look at them afterwards. As Elizabeth mentioned, we do try to seek feedback from workers when we're co-developing. So here's one example of a board. We did like a voting board. People love to vote, put stickers on things, and tell you what they think, right? So we were at this event that's hosted by the governor. That's Ag Safety Day that happens, I think, 3 times, right? There's a new one actually next week up in Skagit County, where Denise and Elizabeth will do a training on sexual harassment prevention in the workplace for ag. But there's also some in Yakima and one in Wenatchee. And here you can actually see one of our former coworkers and student, Idanis Cruz, who was facilitating the conversation. We're trying to develop a new material looking at acclimatization or adjusting to working in the heat, which we know that workers are 35 times more likely to experience heat-related illness compared to other industries, and about 75% of deaths that happen in heat because of heat occur within the first week of working on the job. So acclimatization is one of the prevention measures, right, or the prevention messages that we can use to inform and protect workers. But we were trying to figure out how do we describe this when science still hasn't really figured out all of the details, right? We know that there are some best practices already in place, and so we're trying to get some input from workers on the scheduling, right? As you're acclimating, every day you want to expose yourself little by little to the heat, right, and letting your body adjust. We're also trying to explore which analogy might be easier for people to understand, right? the training for a marathon, right? When you're training for a marathon, you're working, you're running little by little, right? Every day. And then breaking in the boots, it was actually breaking in heels, but we went with boots because of workers, right? How many of y'all think how many of y'all think that the training marathon was the most popular amongst the workers? Raise your hand. How many of y'all think that the boots was more resonated? I thought that too, but it was actually a split tie. The workers liked both of them, and so here's our final products that you can see. We also have an amazing graphic designer, Sarah Fish, who does all of these materials alongside Denise as well. And so you can see some of the messages here. I just want to highlight this one, the poster, because we have a message that's always for the worker and a message for the employer, right? Because oftentimes workers will share with us that they don't know what their protections are, right, and what they should be doing. And a lot of the protections that are shared are geared towards the employer, but we want them to both be able to know and hear what is recommended. And so the first box is really the worker, right, like who needs to acclimate. The second one is really more geared towards the employer and like what they can do on the job to protect the workers. And then at the bottom is really that safety messaging, right? One thing that I'll note on these graphics is that we've learned that we need to make sure that we're promoting. A lot of our other occupational safety and health colleagues will always tell us, make sure that they're wearing the right PPE and that we're not, promoting a different message that's a hazard. And so you'll see here that we try to, the shade, right, that's a new requirement in the heat rule in providing shade to workers on the job. And then you can see the storytelling pieces, right, of both the breaking in the boots and training for a marathon. And these are all posters that the trainers, there's messages in the HEAT toolkit that are for the trainer to be able to deliver their training. And then these are posters that are shared out to the participant, right? Or they could be posted on the job. Yeah, I don't know if there's anything else. We're almost out of time.
Yeah, I think since we're almost out of time, we just want to go through some of the other resources, just showing you kind of like our social media campaigns, some of the other posters that we've made, and also, I think we want to turn it over to Elizabeth to talk probably about dissemination, because I think that's the most important part.
Yeah, so when we talk about dissemination, we really want to focus on how do we bring this information to the community and into the workers. So many times we use work site visits, and we do trainings. And so, for example, we do the sexual harassment training, or we develop radio campaigns. When we develop radio campaigns, we really think about, are we doing a 1-hour program that is going to give us more time? It's going to give us about 60 minutes to talk about a specific issue that is affecting our community and providing safety messages, or are we doing an informational capsule, which is a 30 to 60 second announcement that is going to be more concrete and more bring the message, in a shorter version. But we also do a lot of drive-through events or health. During COVID, we went to drive-through events because at that time we really recognized that the physical contact was, necessary to keep the 6 feet distance. As we move out of COVID, we do a lot of health fairs, a lot of resource fairs. We also do farm visits. So when we go out in the fields, sometimes we have 15 minutes to provide information to the workers. So we'll take a bag with a bunch of information and provide that information to the workers. Or another way to reach out to the community is using print materials like posters, and go out to the stores or go out to the farms and post these posters, in places that people are able to really have access to this information. And so it is, when we talk about dissemination, it's not only one way to disseminate information or bring this information to the community. It is more of a collaborative effort in bringing and using different platforms to bring this information. Doing the social media campaigns, using the website, and that will help us to reach out a broader the community, but also in different ways that it's a repetitive message, it's a continuous message, because a one-time map time reaching out to the community is not going to change any of the behaviors, or is not going to improve people's health. And so it has to be a repetitive message and constant message to the community.
Yeah, thank you, Elizabeth.
I just want to share quickly that we do digital stuff too, and on social media and stuff, but we've evaluated our dissemination, and what matters most is the work that Elizabeth does. Like, if we didn't have partners like her who are first of all championing more for workers and pushing us to do more, and then also have that trust of the community, I just want to highlight how without Elizabeth, that wouldn't be possible.
Yeah, thank you for that, Denise. Yeah, it's very true. We're all really lucky to be able to work with Elizabeth. I think we'll just move through this one. This is another kind of toolkit. You'll have the slides, work that we're doing to then help other community-based organizations like Elizabeth that are wanting to now reach out to farm workers or people that speak diverse languages. We've developed a toolkit that provides some best practices, and then there's actually an online digital board where they can post their own resources, and it's more of like a resource sharing platform. And then here's QR codes if you wanted to see any of the materials that we shared. We do have some magnets up here. Something new that we've heard from people like Elizabeth was that we want, paper is fine, but also like how do we share messages that people can use? And magnets are so popular, right? Like how many of us still use magnets? So we decided to create this one magnet that's heat or smoke. So it kind of shares the AQI and what you should do in the workplace or at home, both in English and Spanish. And then, we'll close out a little early, but again, workers are experiencing climate impacts. The need for comprehensive community-based messaging is really important, and also need for more policies, right, and protections in place, but also translating those in a way that people can actually know what those protections are. And then we do have some student research opportunities, so if you're all interested in any of this work that we just shared, feel free to reach out to us. We love students, and a lot of our teams and a lot of the work that we're doing is actually always has a student involved. So thank you. Yeah, questions? 2 minutes for questions.
Thank you so much. We have time for one question, I think. Yes, we've got a question up here. Maybe you can just repeat it. Yeah.
What's like the employer response to these kind of?
What's an employer response?
Yeah.
Do you want to answer?
Sure. Well, I actually need that.
Yeah.
The employer response to what?
To enacting these policies.
Enacting that policy.
Yes, that's a very difficult question to answer. I think for the most part, employers don't like when there's more rules that are required. A lot of times because they have to figure out how to implement them. The rules, they tend to be very technical, so they'll be like even with acclimatization or things like that. Like how do you slowly adjust workers into doing work that's super physically intensive and fast-paced. But I want to say that, we've met some employers, especially the ones with more resources, that, there are some safety champions out there. But I would say for the most part, they don't want progress or additional rules.
Yeah, we do have some projects where we're actually working really closely. I'm working on a project right now that's looking at how climate impacts mental health in workers. And we have an employer, right, that's our partner, in figuring out what kind of tools would be effective for implementing in their workplace and promoting health and well-being in their employers. Yeah, so thank you all. Gracias, Elizabeth.
Thank you so much. When will be done? Look forward to your reflections and further questions, and have a good afternoon. So take care.
Thank you, Elizabeth. Nos vemos pronto.
Bye.
Take care. Bye.